morning. Welcome to the Capitol Rotunda. We're here today to discuss lung cancer. The Arkansas Cancer Coalition is a group dedicated to several goals with respect to different cancers. And in an effort from the Lung Cancer Committee, we are trying to gain more recognition and acknowledgement of the importance of lung cancer in the country, and particularly in the state. With that in mind, we asked Governor Beebe, and he has signed a proclamation which we have here, which does declare November as Lung Cancer Awareness Month. Lung cancer, I should say thank you, Governor. You may not know that lung cancer is the major cause of cancer death in the country and in Arkansas. And you may not know that we're actually the 5th in the country in terms of the number of deaths related to lung cancer. This is a bad statistic. We'd like to be 52nd. So welcome here. We're going to have a few people speaking about lung cancer or tobacco control, one of the important aspects of any discussion of lung cancer. And I'd like to start with a few words from Representative Greg Reed. Greg, thank you for coming.
Doctor, thank you very much. It's certainly my pleasure to be here this morning. And I guess in my official capacity as chairman of the House Public Health Committee, but I certainly want to thank the Cancer Coalition and everyone involved in putting on this press conference and making sure we get the word out to the public about the needs that we have in Arkansas and this whole issue of cancer, specifically lung cancer.
Smoking is the leading cause of preventable death in the United States, killing over 400,000 people every year. And about 128,000 of those individuals die from lung cancer. We also know that secondhand smoke is the 3rd leading cause of preventable death in the U.S., killing more than 50,000 non-smokers each year. There are things we should be doing and pursuing in the areas of prevention. Number 1, we should be pursuing a well-funded tobacco prevention program. Currently in Arkansas, our program, tobacco prevention program, is funded at 54.4% of the recommended, and that's the minimum recommended level recommended by the Centers for Disease Control. Fiscal year 2010, we're spending $19.8 million in the state of Arkansas. But guess what? The recommended level is $36.4 million that we should be spending. When it comes to incoming revenue coming into the state, tobacco related, that would be your MSA dollars, tobacco tax, it is estimated that that amount is about $276 million per year, but yet only 7.2% of that amount is being spent on prevention and education.
So much for this opportunity. I'd like to thank this board, the Arkansas Cancer Coalition, for inviting me and being a part of this wonderful program here today. In the 2006 General Assembly, the state of Arkansas passed Act 13. And Act 13 covers kids in an automobile that prohibit parents from smoking with kids in the car from the age of 0 to 6. If you do the math, that's only covering approximately 24% of the kids in the state of Arkansas. So with that in mind, over 70% of the kids are not covered. Last year in the General Assembly, I introduced a bill to increase those numbers. And we should do more for our kids because there's more that we can do. One of the things that I'm going to do within the next 7 days, I will be filing another bill. And this time, I think if we can get people like you all to come to the Capitol and other organizations around the state of Arkansas to come and participate, I think we will be very successful.
on a daily basis when it comes to tobacco. As a performer, before 2006, I had to perform in conditions regardless if I wanted to check, and if I wanted to work, and if I wanted to express myself through song, I had to work in venues that allowed smoking. After 2006, that doesn't happen for me anymore. I have a right to choose where I want to perform, but I have another job, but then that's their full-time job. I stand here saying that we do need to make sure that we remove those exemptions in Act 8 to include restaurants and bars and allow no smoking whatsoever.
Thank you for the invitation. This is a wonderful program. The best treatment for lung cancer is prevention, and previous speakers tried to reinforce that very, very strongly. In reality, a lot of those patients who are fortunate to develop lung cancer, we have to provide still the best care we can. One of the issues that often we see in our clinic is that patients are often overwhelmed by the diagnosis, by the new diagnosis of lung cancer. The last two questions, which are very important. One has to do with participation in clinical trials. In the United States, about 2% of our cancer patients participate currently in clinical trials. And I think strongly that this number has to be increased. We have a lot of patients who don't do very well, especially when they have later stage lung cancer. They don't do very well with traditional standard care chemotherapy, and we need to do better.
We applaud each and every one of you. Our coalition represents a broad spectrum of advocates from all over the state with different disciplines who really want to help eradicate lung cancer in our state. Primary prevention is key, but there's also help as it relates to early detection, diagnosis, and treatment. And for those who do want to quit, there are free resources out there, and it's 1-800-QUIT-NOW that they will call to get help today. So I applaud you, I thank you. You've heard the statistics, please take note, and we hope you'll join us to make a change in our state for healthcare Arkansas. Thank you.